So today we're going to learn how to use cantharidin, and the materials basically that you have, if you could just look in here, it doesn't matter which brand you really buy, but this is Cantharidin by Paladin, okay? And you want to have 3M Blenderm tapes. I don't know if you can see inside here the brand of tape in there, okay? And then a cotton tip applicator. And okay, so cantharidin is a blistering agent that causes separation in the spinous layer. Do you see that? Did you focus in on that? Can you see?
Yeah.
Okay, there's a drop there. Alright, so it depends on the lesion you're trying to treat. Usually a drop is actually sufficient. You put the drop, and you want the drop to appear like that on the lesion. Can you see that? You're zooming in there? Okay. Now if I've already dripped once and I go again, you see there's much less of a drop there? But there's still a drop, okay? That's probably not enough, and this is probably a little too much. So somewhere in between. It depends on the size of the lesion that you want. But if you want to treat, I don't know, this is the lesion. So you put it in here, and this is about right. You see, that's perfect. If for some reason I had too much, there was too much around here and that's too wide, so I would take the Q-tip and I would just wipe around, because this part didn't touch the lesion, only the back part did, okay? Now obviously, excuse me, if I just touched a wart or some infectious thing, I have to dispose of the Q-tip and use a new one if I need to add more stuff to the lesion, okay? Now the idea is to make basically a thin coat of material. You don't want the material to spread beyond, say, 3 millimeters beyond the lesion, and that's probably too long. You want to avoid the reflex to double dip the wooden tip back to the stock bottle. Rather, discard the applicator and get a new one. So it's very easy to dip here and go and say, oh, I didn't have enough. Dip here and go. You can't double dip. That's like very important, okay? Once all the lesions are treated, you place this Blenderm tape over the lesion. So, unlucky with the phones today. But here's the Blenderm tape, and you would just place it over the lesion. Okay, you can see how it traps the cantharidin right in the place. And this is the same thing as if it were your skin. Okay, and now that prevents me from sucking on it, from it rubbing to other places around the body, and so it's very protective. Okay, once you're finished using the cantharidin, you want to close it as soon as possible, because an accidental spill is very difficult to clean up and it's dangerous material. And so, you know, the Blenderm tape, it prevents the medicine from rubbing on other skin parts, on clothes, on furniture, or other people, because once this stuff gets on someone else, it can blister that other person. And it also prevents a child from putting the medicine itself directly into his or her mouth. If a child is too young to follow instructions of not to suck on the area of skin with the medicine, then you can't use cantharidin for that patient. That's for sure. But frequently cantharidin is used when you don't want to cut or freeze something like a molluscum or a wart on a child because you know, they can't tolerate the pain or the idea of a blade cutting them, and so you just put this liquid on and they don't think of it as anything. Now it may be painful like 4 hours later, but there's no pain right when you put it on, and so they permit you to do it. You don't want to store the stock bottle of cantharidin on a mayo stand. So here, we can come over here. I mean, this is a cluttered mayo stand, but you don't want to put cantharidin here because if someone bumps the stand and it falls, that's a problem. Okay. And further, as a general rule, no stock bottle of any medicine should be placed on a mayo stand because that's where the patient's blood is and everything like that. We said the physician should wear gloves while handling this and the cotton tip applicator. Finally, sometimes the wooden parts of the applicators can be broken in half or thirds. Each of these parts can be dipped into the cantharidin and then applied to the lesion. So, you know, sometimes it's wasteful to dip and go and then throw it out, right? So beforehand, I can break this in half, and I can break this, and you can see here that and it's actually pretty neat. When you have a very fine area that you really want to paint carefully, so I can use this end and now I can trace out exactly where I want to go. You can see that? Can you see the wetness?
Yes.
Okay, I can then turn this around and use this side and put a little more. And see, it's not coming out so great. Okay, I'm going to discard this. It's actually sticky. And here we go. That's a better one. So here the capillary action absorbed a lot of material, and then it was able to come out. And here I can again use the other side, and again you see a big drop here or lesser drops. So depending on how much you want to use, you can take a bigger or lesser drop. And then finally, dipping the cotton tip applicator is not recommended. If you put the cotton part and you want to dip that, first of all, the cotton absorbs a whole lot of medicine here, and if I don't dip it very quickly, okay, it, like you see, not that much comes off the tip relative to the amount of medicine that's on here. On the other hand, if right away, and I'm double dipping because I ran out of cotton tips, but if I right away plop it, you see a whole ton of medicine comes out, and that's too much, maybe, for a small lesion. So you have to, I wouldn't use the cotton part of the applicator for this process. I think we're done.